Hello, today I want to talk to you about the properties of breast milk. The perfect food for our babies is their own mother's milk. As you know, no living being in nature except for us receives any formula support. Because nature has arranged everything so beautifully that, for example, the milk of a mother who gives birth on time is even different from that of a mother who gives birth prematurely. Breast milk has the properties to meet all of a baby's needs except for vitamin D in one head. To support nutrition, child-friendly hospitals and child-friendly doctors' practices have now been initiated in our country, and I believe the importance of breast milk is now sufficiently recognized. After your baby is born, there will be many recommendations for increasing breast milk, but two scientifically proven things are important. The first is your breastfeeding frequency stimulates the breast. The second is the amount of fluid you consume, because breast milk is a body fluid like sweat or urine. And the amount of fluid you consume in its production is quite important. The most enjoyable practice you will do to stimulate your breast will be breastfeeding your baby. In terms of content, breast milk has the properties to meet all of your baby's needs in terms of the balance of fat, protein, and carbohydrates. And one of its greatest advantages is that you can pass on the protective antibodies you have gained from all the infections and vaccinations you have had so far to your baby. This is a feature that no formula can replicate. Of course, we aim for our baby to receive breast milk directly from the breast, meaning we support breastfeeding. The way the baby holds the breast while breastfeeding is very important, because the effective emptying of your breast is entirely dependent on the baby's sucking effort. Therefore, while breastfeeding your baby, try to ensure that the lower and upper lips are fully turned outward and that the entire brown areola is close to the baby's mouth. We never recommend a time interval while breastfeeding. In the beginning, we need to breastfeed our baby every time they cry. Because their stomachs are very small, our babies get full very quickly. Additionally, breast milk is very easy to digest. Within half an hour to 45 minutes, breast milk passes into the intestines. That's why your baby may get hungry frequently. This does not mean that your milk is not nourishing. Therefore, we need to breastfeed our baby as often as they want to stimulate our breasts and increase the amount of breast milk. Another thing we need to pay attention to is this. Sometimes, especially after cesarean births, breast milk may not come in immediately. Postpartum, whether cesarean or normal birth, early contact of the baby with the mother's skin and early attachment to the breast are among the most important practices to initiate breast milk production. It is especially important to pay attention to this. If you feel any pain in your nipple while breastfeeding your baby,